Thank you so much. Well, welcome to the Joint Assembly and Senate Subcommittee, Government and our Finance Committees. I'm going to go ahead and call this meeting to order. Can the Secretary please take the roll?
Senator Brooks, Senator Dennis,
Here.
Senator Gokachia,
Here.
Assemblywoman Gorlow,
Here.
Assemblyman Hafen, Assemblywoman Howdigi,
Here.
Assemblyman Levitt,
Here.
Assemblywoman Miller,
Here.
and Chair Peters.
Here, thank you. Will you please mark Senator Brooks absent, excused, and mark Assemblyman Hafen present when he arrives. Today we have one budget, and well, I guess before we get started on that, I'm just going to do the regular housekeeping stuff. The public has access to this committee meeting via Nellis or our YouTube channel. You are welcome to check out the agenda there and any presentation materials, as well as participate in public comment at the end of the meeting. Public comment is limited to 2 minutes per caller. However, you are always welcome to submit written comments to the committee at any time. And with that, a couple things for presenters. Would you please remember to state your name clearly for the record? It is so helpful for the secretaries to have that when they're taking the minutes. And for members, if you don't mind muting yourself when you're not speaking, that helps with the background noise. And with that, let's go ahead and get started with the budget presentation.
Ms. Krupp, this is broadcast. You are on mute. You will need to unmute yourself in Zoom.
Good morning. Thank you so much for that. This is Jennifer Krupp for the record. I'm the Chief Financial Officer here at the Silver State Health Insurance Exchange. And along with me, I have...
Good morning. My name is Ryan High. I'm the COO of the exchange here. Today we'll be going over our agency overview, our strategic priorities, our marketplace landscape, our exchange enrollment, our outline of special enrollment periods, our SBE operations, our reserves, and we'll have time for Q&A. I would like to say that our Executive Director, Heather Korpulik, she says she's sorry she's not here today, but she is doing a special assignment over at the Governor's office. But I think Jennifer and I will do well today presenting the exchange. So without further ado, we'll jump right in. So the Silver State Health Insurance Exchange is a state-based marketplace. We operate the online marketplace, NevadaHealthLink.com. We connect Nevadans who are not insured by their employer or Medicaid or Medicare to health insurance. Individuals can purchase Affordable Care Act certified health plans through the exchange. And if eligible, consumers can receive subsidy assistance to help offset monthly premiums, and about 4 out of 5 Nevadans do qualify for these subsidies. We're solely self-funded. No state or federal funds are needed to operate the exchange. And our mission is to increase the number of insured Nevadans by facilitating the purchase and sale of health insurance that provides quality health care through the creation of a transparent, simplified marketplace of qualified health plans. The next slide shows a little bit about our org chart here. Okay, sorry. Our strategic priorities. Our strategic priorities are to increase the number of insured persons in Nevada. Second, to facilitate the purchase and sale of qualified health and dental plans. Third, to provide consumer education and outreach on matters relating to health, to enrollment and effective use of health insurance. And fourth, to assist residents of Nevada with access to programs, premium assistance tax credits, and cost-sharing reductions. So our open enrollment plans for 2021, we had 50 traditional QHP plans, and QHP as qualified health plans, plus 3 catastrophic plans through 5 carriers. And those carriers were Health Plan of Nevada, Silver Summit, Anthem, Friday Health Plans, and Select Health. As I said, we had 3 catastrophic plans, 19 bronze, 25 silver, and 6 gold. These are our metal levels. Nevadans in Clark and 9 counties have choices available from all 53 plans offered from the 5 carriers. Washoe County has 48 plans available from Health Plan of Nevada, Anthem, Silver Summit, and Friday Health Plans. And Carson, Churchill, Douglas, Elko, Esmeralda, Eureka, Humboldt, Lander, Lincoln, Lyon, Mineral, Pershing, Story, and White Pine counties have 37 plans available from Anthem, Silver Summit, and Friday. And this chart here, this is a year-over-year chart about our enrollment. This year, we ended up with 81,903 consumers. Okay, next slide. Great. So our final plan selection was 81,903. Our new consumers, 25,200, and I need to make a correction here, 297. And the re-enrollees was 56,606. Now, moving to a state-based exchange, we were able to offer special or extended enrollment periods. And that's the flexibility we have in being a state-based exchange and off of the federal platform. We're allowed for these multiple agile special enrollment periods. So we had one from March 17th to May 15th, 2020, which was an exceptional circumstance SEP related to the COVID-19 pandemic. We also had one, we extended our open enrollment period, our traditional open enrollment period. We went from December 16th to January 15th. And this was an extended open enrollment period known as the Marketplace Stabilization SEP. Currently, we're in a February 15th to May 15th missed open enrollment period SEP. And this is due to the continued COVID-19 pandemic, and we allow this open enrollment period for our consumers. And we have an upcoming April 2021 special enrollment period related to the American Rescue Plan Act, or ARPA.
Thank you, Ryan. So now we'll move into the governor recommended funding changes. Again, this is Jennifer Krupp for the record. The budget highlights include for the 21-22 state fiscal year, it will be a total $18,853,472 budget with fees and reserves. FY23, which is 2022 through 2023, is $17,424,645 with fees and reserves. We're taking the exchange up to 26 total positions with 22 existing positions and 4 new. So the first decision units that we wanted to move into are decision units E350 and E351. These are both funded out of Category 12, which is our Exchange Technology Platform category. In SFY22, we're requesting $464,502, as well as in SFY23, $464,502,000. These represent costs associated with extending the open enrollment, and it increases the Consumer Assistance Call Center hours and access. These 2 decision units will extend open enrollment to January 15th of each year and include full weekend call center coverage and capacity at a fixed cost throughout the duration of the contract. Initial costs for this decision unit were actually approved in state fiscal year 21 through work programs WPC 51386 and C51387. The reason that we've included these two decision units is because on June 29th of 2020, the board of the Silver State Health Insurance Exchange approved Regulation EX05, which provides the board authority to establish a market stabilization special enrollment period to supplement the federal open enrollment period, which runs November 1st through December 15th, which does allow additional time for Nevada consumers to shop, apply, and enroll in coverage on the exchange. So on July 21st, the board directed the exchange staff to create an MSSEP, which effectively extends the OEP to January 15th of each year, as Ryan had indicated earlier. So the extended consumer assistance call center functionality and weekend call center capacity to maintain OEP staffing levels through the end of each MSSEP allows the exchange to meet the needs of Nevada consumers, enrollment professionals, and brokers, and ensures the consumer assistance call center is fully and appropriately staffed to handle consumer inquiries.
Ms. Krupp, do you mind if we ask a couple of questions on those decision units before we move on?
Sure.
Great. I have a couple of questions from Assemblywoman Gorlow.
Thank you so much, Chair Peters. And thank you for being here this morning. I had a quick question about how COVID and the pandemic has affected the workload at the call centers. Could you talk a little bit about that?
You would like to take?
Sure, I can take that.
Okay.
Yes.
Ryan, for the record.
Yes. Ryan, for the record, Ryan High, Chief Operations Officer. I can give you some quick stats, and maybe this might facilitate some more questions here. But so our PY, our plan year 2020 numbers were for the call center were 1,950,000. Plan year 2021 were 83,000. A lot of those first year calls, though, were because we had to ask consumers to call in and claim their accounts. But for COVID, though, we have seen increases, especially last year through the March 17th COVID special enrollment period. Calls were up about 20%. This year, starting in February of this year, calls were up about 25% over non-special enrollment period weeks.
The other thing, Jennifer, for the record, the other thing I'd like to point out is that the 83,492 phone calls for plan year 21 are all calls that were received between November 1st through March through now. So, I mean, if
it's not
you
a
look
full
at
year.
Our plan year 20 numbers, which is 195,000, you can see that we're already at 50% so early into the plan year versus the full scope of plan year 2020. So, and our plan years run on a calendar year for everybody's information.
Thank you. And follow up, please, Chair Peters.
Yes, Assemblywoman Gorlow, we're having a little bit of trouble hearing you. If you don't mind speaking a little bit more loudly. And also, Secretary, for the record, would you mark Assemblyman Hafen as present, please?
Okay. Is this a little better? Okay, great.
Thank you.
And thank you for the follow-up. Can you talk a little bit more about the extended enrollment period of 30 days and the additional call center capacity for the extended open enrollment period and the increased enrollment?
Jennifer Krupp, for the record, I will talk about the call center capacity and the extended open enrollment hours and what we were trying to accomplish with this decision unit, and then I'll let Ryan talk about our enrollment numbers through the period. But our technology vendor and our call center vendor is Get Insured, and our contract has two different levels of staffing. We have staffing for our call center, which is through the open enrollment period, and we have staffing for the call center, which is through our special enrollment period. So our open enrollment call center staffing is at 48 call center employees that are there, specifically working on Nevada, taking Nevada calls, and handling Nevada consumer and broker inquiries. During our special enrollment period, that number drops down to 28 because our call volume isn't the same. So when we decided to extend the open enrollment period, we needed to increase our capacity in the call center to meet that 48 call center personnel number so that we could continue to meet the needs of our Nevada consumers and brokers that we're calling in. So we're going from 48 to 28 staff members through that extra 30 days from December 16th through January 15th.
And then Ryan Hines for the record. So moving to a state-based exchange, we have this flexibility. We can be more agile than, let's say, the federal government. So to give you some quick numbers, the March 17th to May 15th, 2020 exceptional circumstance period, for COVID last year in 2020, we added about another 5,400 Nevadans were able to take advantage of that special enrollment period, which was great. From December 16th to January 15th of this year, about 8,700 Nevadans were able to enroll for the exchange through our extended open enrollment period. And then to date, from February 15th to today, about another 2,300 Nevadans were able to take advantage of this new special enrollment period we have going on right now.
And I'm sorry, I was writing and trying to catch it. It was March through May was 5,400, and I missed the dates for the 8,700.
Yeah, sure thing. For the record, Ryan High, December 16th through January 15th of 2021.
Okay. Thank you so much. And thank you for, especially all those social media posts. I share them every chance I get, so hopefully I brought some business your way.
That's great. Thank you.
Thank you. Are there any other questions from committee members on these two units? I don't see any. Okay, I think we can move on then. Thank you so much.
You're welcome. Okay, I will. Okay, so can everybody see my screen?
We can in the committee broadcast. Can the public see the screen?
This is Stephanie with Broadcast. We can see it just fine. Thank you.
Great.
Thank you. Jennifer Krepp for the record. The next decision unit that we'll move into is Decision Unit E352, and this is SBE Operations, Marketing and Outreach. This request maintains funding for our marketing and outreach at state fiscal year 20 base year levels to continue existing marketing and outreach activities. In SFY 20, the exchange was unable to fully execute budgeted marketing and outreach funds due to the COVID-19 pandemic and shelter-in-place emergency directives issued by Governor Sisolak beginning in March of 2020. So this funding, just to be clear, what we're doing is keeping our marketing budget level with what the state fiscal year 2020 budgeted amount was, which was just over $3.2 million a year. And this requested funding will be used towards continuing marketing and outreach efforts. For us, especially in this time of the COVID-19 pandemic, it's critical to maintain current funding to continue to promote awareness of Nevada HealthLink and the availability of low-cost comprehensive health insurance coverage. That's even more critical now as we're moving into implementing the American Rescue Plan Act. So we're not asking for an increase in funding for our marketing activities. It's really just to keep our marketing budget the same. One other thing to point out is that economic forecasts and industry analysts do indicate that the effects of the COVID-19 public health emergency are likely to remain high for a period of 18 to 24 months. And the reason that we weren't able to fully execute our funding in state fiscal year 2020 was because between March 13th and June 30th, we had 64 different outreach events with a total estimated audience size of 16,558 were canceled. That created a savings of over $55,000. Then when we factor in costs such as event registration fees, community relations development, and printed materials, that also further impacted our ability to fully execute our budget. We had another $79,000 in savings due to the cancellation of planned display media, which were strategically placed in businesses such as laundromats and hair salons and convenience stores. That resulted in a loss of over 5.9 million Nevada HealthLink impressions to consumers. And so if you remember last year in March, we were all under the stay-at-home order. So it didn't, we had to cancel those because there was nobody in those locations to be able to use that. So Therefore, giving the considerations of, the initial effects of the pandemic last year, it's imperative for Nevada Health Plan to continue with our ongoing marketing and advertising efforts. It's very important for us to continue to reach eligible Nevada consumers and ensure that they do have access to comprehensive health insurance. And I'll move on to the next one. Again, Jennifer Krupp for the record. So this is S3E operations, new positions. We're going to talk about decision unit E353. And this request funds 1 classified health resource analyst 2 to absorb functions and responsibilities that were previously provided by CMS. So in the first year of operations as a state-based exchange, the need for a health resource analyst 2, which I'm going to refer to as an HRA2 from here on, was identified to concentrate on the federally mandated data analysis, research, and reporting to CMS. CMS does require the submission of comprehensive enrollment data multiple times throughout the year and weekly during the annual open enrollment period. One thing I do want to note is that with us extending our open enrollment to January 15th, we are also required to report weekly all the way through January 15th. Also, as we have done last year, we did the exceptional circumstances special enrollment period for the COVID-19 pandemic, as well as the second exceptional circumstances open enrollment period that we're in right now. We're also required to report weekly to CMS. I want to say on a week-to-week basis, it's 15 different data points and then a cumulative report that is over 100, I think it's 128 data points. I could be off by a point or two, but that's our CMS reporting. But we also receive multiple requests for data from other agencies, including the legislature, the Division of Insurance, other state and county government agencies, academia, other federal government agency requests, media, and local and national industry organizations. Further, the exchange has over 200 internal data reports that we're working through, and a health resource analyst is needed so the exchange can leverage all of these statistics and trends and reports into actionable decisions that will improve our operational efficiency. This will also provide the exchange with the capabilities to conduct in-house data analytics and provide reporting to all internal and external stakeholders. Current staff are performing these duties where they can, but the number, frequency, and complex nature of these requests and the significant statistical analysis required has become unmanageable. Current staff does not have the capacity to respond to requests or submit the federally mandated reports in a timely manner. And I will move on to the next decision unit. So our next decision unit is E356, and this is requesting 1 classified business process analyst 1 in our reconciliation unit. And this position in our security and reconciliation unit is to support increased workloads due to additional insurance carriers joining the marketplace. The exchange does work closely with insurance carriers who offer health and dental coverage on the online marketplace, and the security and reconciliation unit consists of 2 full-time employees and is responsible for coordinating the activities of 13 different insurance carriers now. And based upon our experience gained in calendar year 2020, each insurance carrier requires a minimum of 10 to 15 staff hours each week to meet the exchange's service goals for the timely investigation and resolution of system discrepancies, many of which impact the eligibility and insurance coverage benefits of consumers enrolled in a QHP purchased on the marketplace. So this really translates into an optimal staffing level of 1 FTE for every 3 to 4 insurance carriers, and the security and reconciliation unit has been operating at a resource deficit essentially since its inception. The exchange is anticipating the entry of 1 new insurance carrier into Nevada's marketplace for plan year 20. Well, we did welcome 2 new insurance carriers for plan year 21, which we're in now, and then an additional insurance carrier in plan year 2022. And we're already starting to think about plan year 2023. And we have had a lot of interest, and so it could again be anywhere from 1 to 5 up to some of the things that we've heard. So, but again, that's a long ways off, and so we don't have more information than that other than we have had significant interest and expect to continue our growth. So And while this is welcome for consumers, the entry of these new carriers will further strain the resources of the Security and Reconciliation Unit. And so this position is requested to bolster the resources of the unit and ensure that our target service levels can be achieved. And the business process analyst, as well as the HRA previously discussed, would both be effective October 1st of 2021. So our next slide is Decision Unit E357, and this is going to fund one classified health program specialist one in the communications unit. Again, the exchange operates as a state-based exchange under which Affordable Care Act health insurance exchange functions are performed between exchange staff and the eligibility and enrollment platform, NevadaHealthLink.com. Marketing, outreach, plan certification, carrier relations, stakeholder management, and broker and navigator functions are provided by the exchange. The communications officer oversees the exchange's marketing vendor and marketing and outreach campaign. The current vendor is responsible for strategizing, implementing, and overseeing all outreach efforts, including event organization, planning, and statewide community relations outreach for targeted populations. This request moves these duties from the marketing vendor to in-house responsibility and coverage by the health program specialist. This will streamline the exchange's efforts to conduct outreach to targeted uninsured and underinsured populations, subsequently increasing enrollment into qualified health plans. The health program specialist is requested for the Henderson duty location and is effective October 1st, 2021. And ideally, the exchange is hoping to recruit a bilingual candidate. Finally, Decision Unit E358 is our last new position request, and this request will fund one classified program officer one in the Consumer Assistance Unit. The Consumer Assistance Unit consists of 3 full-time employees and three full-time program officers and 1 quality assurance manager, and is responsible for coordinating the Tier 3 consumer assistance activities for 13 different insurance carriers. The exchange currently has 1 program officer 1 who's responsible for administering the carrier support program for all 13 carriers and providing timely investigation and resolution of complaints. Many directly impact health insurance eligibility, enrollment, and coverage functions of consumers. So delays in the resolution of these complaints has a negative impact on carriers and consumers alike and can result in the loss of benefits or health insurance for consumers. Due to the complex and time-consuming nature of the carrier support program functions, current staff has struggled to consistently meet target service goals for complaint resolution. Further, the exchange has confirmed the entry of 1 new insurance carrier. We are expecting an additional insurance carrier into Nevada's marketplace in plan year 2022 and anticipated additional carriers in plan year 2023. But right now we have gone from 9 to 13 carriers total, so we're already pretty stretched pretty tight from there. So on we go. Okay, so navigators and brokers. This is Decision Unit E354. And this, much like our marketing and outreach decision unit, request maintains funding for navigators and brokers at state fiscal year-based funding levels to continue sub-awards to the navigators, in-person assisters, and brokers. Navigators and in-person assisters consist of public and private entities that communicate, educate, and enroll eligible individuals in the Affordable Care Act into certified qualified health plans and publicly funded health care through the multiple enrollment methods provided by the exchange. The exchange currently awards funds to 8 navigator entities with 26 full-time equivalent IPAs. In state fiscal year 2020, navigator and IPA entities were awarded a maximum of $3,500 a month per full-time IPA, reimbursable on a billable hour basis. If a navigator or IPA entity had a reduction in billable hours, they would have a subsequent reduction in reimbursements. Throughout the year, billable hours from IPAs would fluctuate depending on demand and consumer need. For instance, there were much higher billable hour reimbursements during the open enrollment period and lower billable hour reimbursements during our special enrollment periods. This reimbursement methodology made it difficult for funded navigator entities to develop accurate cost projections and budgets. Further, The COVID-19 pandemic requiring the closure of non-essential businesses and shelter-in-place orders beginning in March 2020 had a detrimental impact on Navigator IPA entities, and billable hours were significantly reduced. This led to the exchange realizing a savings of over $300,000 in state fiscal year 20 Navigator and broker category. So in an effort to stabilize funding, because we do mostly work with nonprofit community-based organizations that are really reliant on this funding, to stabilize this funding and to provide a more consistent and stable statewide pool of IPAs, in state fiscal year 21, the exchange realigned the reimbursement methodology to be consistent with grant management best practices and reimbursement guidelines as directed by the Office of Grants Procurement, Coordination, and Management. This realignment includes the development and implementation of mutually agreed upon goals and objectives, detailed work plans, and evidence-based evaluation methods used to gauge the performance of Navigator entity partners. Reimbursement is based on the maintenance of full-time IPAs and progress towards the achievement of program goals. This provides Navigator and IPA entities the ability to focus on broader, longer-term goals to identify and assist eligible Nevada consumers with enrollment into QHPs. So Decision Unit E367 for SBE operations. This funds software licensing costs for the exchange to maintain an existing Affordable Care Act compliant casework system. In August of 2019, the exchange purchased licenses for Salesforce using one of the state's master purchase orders and developed the casework system in-house. Initial costs were approved in state fiscal year 2021 through work program C50618, and this request continues funding through state fiscal year 2023. The transition to a state-based exchange required the exchange to implement a secure collaborative casework system for use with Nevada's on-exchange insurance carriers. This system had previously been provided by healthcare.gov, but in June of 2019, the exchange was informed that the healthcare.gov system would no longer be provided. So Affordable Care Act requirements dictate the system's functionality, including custom management of case resolution deadlines. Various software options were considered, and Salesforce was ultimately decided on as the solution was flexible, allowed for the development and implementation of all required functionality in-house without the need for contracted programmer resources. So these decision units to the $7,310 in state fiscal year 22 and the $10,979 in state fiscal year 23 are the contracted increases that we will have to pay each year. So the base amount was $49,000, and I can't remember the exact number, but some change. So moving into state fiscal year 22, it's going to be like $56,000, and then state fiscal year 23, it's going to go up incrementally from there. So that's why these numbers are a little different. So. All right, so SBE operations decision unit E361. This request funds state printing and postage costs for outgoing correspondence to exchange consumers and state printing costs for a partnership with the Division of Employment Training and Rehabilitation DETR to include exchange information on unemployment insurance mailers. So when DETR mails out letters to UI claim filers or recipients, then we'll include information about the exchange so that people can continue to maintain health coverage. And then finally, equipment, decision units E710, E711, and E366. These are in categories 26 and 4. E710 requests the replacement of computer hardware equipment per the EATS recommended replacement schedule, and these equipment replacements are scheduled to occur in state fiscal year 23. E711 requests funds in replacement of the video teleconferencing equipment per the EATS recommended replacement schedule. That's scheduled to occur in state fiscal year 22. And E366 requests funds a new copier lease for a second unit located in the Carson City office for $2,700 in both state fiscal year 22 and 23. So finally, we'll talk about our reserve projections. Based on current projections, the exchange expects to maintain 180-day or above 180-day reserve in state fiscal year 21 through 24. And one thing that I did want to point out, while this is generally a higher reserve level than is recommended, because the Silver State Health Insurance Exchange is still subject to so much uncertainty in the marketplace, and we've moved out of this era of the questionable ACA, if it's going to be consistent or if it's going to stay. I think we feel pretty confident that it's going to stay, and that we're going to continue on. However, we are, and the American Rescue Plan Act is a very good example of that. We are sometimes subject to federal legislation and mandates that we need to implement quickly, and that do come at a cost for us. And so that's why we are requesting the higher reserve levels. So, and I did want to point out that when this budget was originally written, thinking back, we were looking at, when we were putting in our projected revenues and our projected reserve balances in August of 2020. So we budgeted them extremely conservatively. And so this budget is really based on a worst case scenario for the exchange. We weren't sure if our enrollment was going to decrease significantly as more of our consumers would move on to Medicaid, or if they would be staying on the exchange. But, now that we're 5 or 6 months later, and we're seeing our plan year 2021 revenues, we're feeling much more confident in the stable income levels or revenue levels of the exchange. And that's everything I have. So we're happy and welcome to take any questions. Our contact information is here in the PowerPoint. And thank you very much for your time.
Thank you.
Thank you for the presentation. And we do have a couple of questions related to some of those areas. I'm going to go to Assemblywoman Miller first.
Thank you, Chair. My questions, I want to go back a little. During your presentation, you mentioned that, and you listed multiple entities that have been requesting data and statistical analysis from the exchange. And I was just wondering if there are any factors that you think are contributing to an increase in those requests?
Quite a bit of it has to do, not to say that everything's a result of the COVID-19 pandemic, but we have been getting quite a few more requests due to the pandemic, and quite a few more real-time requests related to information that people have been asking for. In response to the COVID-19 pandemic, especially when it comes in terms of, the number of additional people who have been able to obtain health insurance coverage on the exchange. And then I think Ryan can probably talk a little bit more about some of the, and this has kind of been one of those areas where, like, the first part of last year, this kind of the data requests kind of fell under me, and then they got moved to Ryan. And so if, we're kind of going back and forth, it's because we are a small organization and we've had to be agile and nimble, and we've all kind of picked up where we could. So at the first part of last year, it was a lot of information requests that were related to, the health insurance coverage that was, offered through the COVID-19 pandemic. A lot of requests from our insurance carriers for pretty deep. That was one of the biggest things, is that we were now able to offer member-level enrollment information to our individual QHP plans and our standalone health plans, dental health plans. So we were able to provide our carriers last year with some pretty detailed reporting that they weren't ever able to get from CMS. So, broken down, by the number of consumers that they had broken down to their zip code level and now at the county level. So, and whether the consumers were new consumers or new automatic re-enrollees, or if they were, active re-enrollees, or they actually came onto the exchange platform and made changes to their accounts.
Okay, and I would like to echo what Assemblywoman Gorlow said, and just about the amount of information that we saw being pumped out, and the flexibilities in changing deadlines and dates and stuff like that to accommodate what was happening in people's lives as people were losing their jobs and needing assistance. Obviously, we really appreciate that, really appreciate that. I have one more brief question, and I don't know if you can answer it, because I know what the technical answer is, that it all depends on the menu of services and the selections and your age and your health and all this kind of stuff. But on average, how much does it cost a Nevadan if they just to get into the plan? Do you have some kind of average numbers that it costs each month?
No. Trying to see if.
And I know it's determined by so many factors.
Yeah, and I'm a numbers person, so I'm kind of going through, but I think our average premium in plan year 2020 was $774, but then the out-of-pocket average that they paid was $185.
It's close to 200.
Yeah, it was close to 200.
About 200.
But please, with that number take into consideration, that includes households that are one person or households that have 8 people, when it's an average of all of those numbers. So it's not going to be like the best reflection of like maybe what a single individual would pay, but overall, considering like the entire household average, that's where we were in plan year 2020. I haven't seen the numbers yet for plan year 2021, but Ryan may have.
Yeah. So for the record, Ryan, hi. I would say that we always promote that about 4 out of 5 Nevadans can take advantage of our advanced premium tax credits. And it was about 69,000 Nevadans last year were able to take advantage of that advanced premium tax credit by buying an exchange plan.
Okay, great. Thank you so much. Thank you, Chair.
Thank you, Assemblywoman, for the question. And I would also like to echo, I was a user of the exchange for a period of time, and you guys have made quite the strides on accessibility and openness, and the call center is making a huge difference. Those more open times can be just the lifesaver for some folks who are struggling to get insurance. So kudos and congratulations on those efforts. Thank you so much for doing that. I have another question from Senator Dennis, please.
Thank you. So my question has to do with the, historically you've used a vendor to do your marketing. And so now you're out doing you're going to redo the contract with your vendor, but instead of having the vendor do the high level strategic planning and outreach, you're proposing to have a position now within the agency within the organization to do that. So what factors did you consider when you were determining that need for the outreach and everything and that representation in Southern Nevada?
Thank you for your question, Jennifer Krupp, for the record. We considered many factors, primarily the cost was a big factor. Previously in our contract is just changing. The Board of Examiners has approved our new contract, at which RFP beginning on April 1st. So we'll now be contracted with the Abbey agency. But our previous contractor, we were paying roughly $16,000 a month for these services. And so being able to bring the service in-house came at a significant cost savings to the agency, and it allowed us to move more of those dollars that were in our marketing budget into actual advertising and direct media that could broaden the exposure of the exchange. But then we also really wanted to have somebody full-time on staff that would, be able to provide more of a dedicated mindset towards these types of activities and really be working within the community and working with our stakeholders one-on-one and just be, primarily focused on those activities. Those were the big things that we thought about.
So, and then specifically, you're putting that position in Henderson versus somewhere else. Is Southern Nevada where the majority of the need is?
It is where the majority of our need is. Most of, as with most things in Nevada, but most of our enrollees in our consumer base is in the Clark County area. Most of the stakeholders, especially with the Navigator program, are based in the Henderson area. We work very, very hard to make sure that we're partnering and working with community-based organizations on a statewide basis. But I think of the 8 entities that we have, 5 of them are in the Las Vegas area.
And do you think that the current level of service that you're doing with the vendor, that you're going to be able to continue that or maybe even make it better?
Our intent is, sorry, Jennifer Krupp for the record. apologize, I get a little enthusiastic, but our intent is to continue to expand and grow our outreach and our marketing efforts. So we feel that having this health program specialist in the Henderson office will facilitate that expanded outreach and growth. We still have about 100,000 people in Nevada that are qualified for coverage on the exchange and would qualify for subsidies. And so our goal is to continue reaching those people and continue to close the gap on that number. So.
Great. Thank you very much. Thank you, Madam Chair.
Thank you. I have a couple more questions from Vice Chair Howdigy.
Thank you, Madam Chair. And I just want to go specifically to Decision Unit E358 and the Program Officer. I know in your presentation you mentioned that going from 11 to 13 carriers has you guys stretched very thin, but can you walk me through what kind of complaints are escalated to you for resolution?
And I'm going to pass this one to our Chief Operations Officer, Ryan High.
Sure. For the record, Ryan High, the COO of the exchange. So the types of tickets that come to our quality assurance unit, these are above. So our calls, we have a contracted call center with a Get Insured. They handle Tier 1 and Tier 2 types of calls. Tier 1 might be a password reset, let's say. Tier 2 may be something that might be escalated to a supervisor at the call center. So the Tier 3 calls that the call center will pass to us will be something that requires more detailed research or maybe some action taken by the exchange. These might be things like maybe backdating an enrollment coverage, maybe if for whatever reason there's an issue between our system and the carrier, or I'm sorry, the insurance carrier system, maybe an enrollment can't be found. So we have to do some research, figure out why it's not found, and reconcile that. Or maybe reinstatement requests. Maybe a consumer needs their insurance coverage reinstated. So those are the types of calls that we get, and why. As we add carriers, you can probably guess that we'll get more calls and more reasons to research and answer these types of questions.
And then if the recommended new positions are approved, do you think you'll be fully staffed up to accommodate the workload?
So,
well, yes, but I feel like we'd still probably be feeling stretched thin. We've grown quite a bit.
we have.
So yes, yes.
Okay. For now, what I'm hearing, yes, for now.
Yeah.
Kind of.
Yes,
Okay.
now. There's so many curveballs, that have been thrown. And so there's been,
Yes.
A lot of things that, may have happened over the last year that have increased, or put a strain on our capacity. That, when you look at this, strategically from a 10-year perspective, will these things still be in play? So looking at if things were normal and if this was just the expected growth over the next couple of years and we didn't have this public health pandemic and crisis, I think that we would be feeling like the 4 additional staff members would have us well staffed. I think the additional responsibilities that we've absorbed as a result of the pandemic have, as with all of our state agencies and partners, we've all been working a lot extra.
And it's, for the record, Ryan High, it's been a very interesting year, and that's why we were pausing, and Jennifer and I were looking at each other. We had this special enrollment period last spring in March, and then we had to extend we were able to extend our open enrollment period into January. And then with this new SEP, this new special enrollment period we have right now with the COVID pandemic, that we're currently in right now, we didn't anticipate any of these. And then the American Rescue Plan Act, this ARPA Act that's coming up, none of this was planned for. So that we're trying to answer your question. We think there will be enough resources and staff, but with the exchange, it seems like there's a new thing coming every quarter almost.
Okay. Thank you, Madam Chair. That was it for me.
Thank you for the questions. I kind of wanted to talk a little bit about what you're expecting, or if you've had the opportunity to assess from the American Recovery Act, the impacts that may have on the exchange. I have a vague memory of hearing a report that the federal subsidy may go up for those exchange networks, and for the people who qualify for those. And so can you just talk a little bit about what those that will do to your office, and where you see there may be some need for additional flexibility again?
So some of the most exciting things that are, I apologize, Jennifer, correct for the record, but some of the most exciting things we're looking forward to with the implementation of ARPA, or the American Rescue Plan Act, is the people who are at or below 400% of the federal poverty level are now going to qualify for increased subsidies. So that's going to allow them to buy more generous plans, or it will allow additional consumers onto the exchange because plans are going to be more affordable. But then, with these increased subsidies, but then what is very exciting is that we're going to be increasing subsidies for that population of over 400%. So we're moving now to a place where everybody is going to qualify for subsidies. It would be more rare that a person didn't qualify for subsidies to purchase health insurance on the exchange than not, which is very exciting because when we had run some analysis previously last year, we had a large population of exchange enrollees that actually did fall into that above 400%. I mean, 20% of our population, so roughly 16,000 people a year, or Nevadans a year that are currently buying insurance on the exchange, are now going to qualify for subsidies where they hadn't before. Some of the other provisions that are really exciting is that it moves your maximum out of pocket that an exchange carrier, and I might be getting this a little bit wrong, but the income cap is going to move from 9.83% down to 8.5%. So that's the amount of household income that a family could apply towards their premiums each month. So again, that's another factor that's going to make insurance coverage much more affordable for Nevadans. And then, looking at some information that came out from HHS earlier this week, there in Nevada specifically, the uninsured population that's now going to be newly eligible for subsidies is going to be about 41,000 people in Nevada. And then the uninsured population that's now eligible for a $0 benchmark marketplace plan or marketplace coverage is going to be 6,100 people. So that's 6,100 people that will be able to purchase insurance on the exchange and have $0 out of pocket, right? Yep. So
those numbers are incredible. Those really life-changing. That accessibility becomes a reality. I was also just hoping to have you kind of go into the trends you've seen in the carriers who are interested in participating in the exchange. I have this memory that you guys have had a dip and have really recovered from that with 13 carriers now. But also, what are those carriers' services that they're offering, or the not services, but the coverage that they're offering, and how? And I'm specifically thinking like how many are healthcare and how many are dental and how many do you have any vision? So if you could just describe those things, that would be great.
So I think Ryan and I will both take parts of this question. So Jennifer, for the record, our current carriers for Plan Year 21, we have 5 qualified health plans. That is HPN, Anthem, Silver Summit, Friday Health Plans, and Select Health. And then we have 7 dental carriers. I think I might be able to rattle them off from memory, but it's also Delta, Rocky Mountain, EMI, and I can't remember what EMI stands for, so I apologize. Who else am I missing? Best Life. Mm-hmm. And there's one more that I may need to get back to you on.
and for the record, Ryan, we were able this year to also offer standalone vision care through VSP for consumers. We had a link on our website for consumers that wanted to take advantage of just standalone vision insurance as well. And I think the interest we're getting for next plan year, we're still in the process now of getting letters of interest for next plan year, but we're seeing interest from both national and local carriers.
And Jennifer Krupp, for the record, Liberty was our final dental carrier.
Liberty. Thank you for that. And again, I think that this is an area where we are seeing interest because of the accessibility, and that is making a huge difference to the marketability of these kinds of exchange networks. And when we are a state that really thrives on small business, that means a ton, being able to have your employees get coverage, and not have that cost and overhead for a company with 3 members, 3 employees that's huge. So thank you so much for all of your work. Are there any other questions from the committee? I don't see anybody raising their hand, so I think that is all we have today for you. Thank you so much for the presentation and the information. Really appreciate you guys being here.
Thank you.
Thank you.
All right, and with that, we'll move on to the last bit of our agenda, which is public comment. If we could just check the public comment line, see if anyone is on and interested in calling in. And
Chair, this is Michael from Broadcast. I will see if anybody is ready to make public comment. In order to make public comment, please press *9 now to take your place in the queue. Caller with the last 3 digits, 528, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Madam Chair, members of the committee. For the record, my name is Barry Gold, BARRYGOLD, and I am the Director of Government Relations for AARP Nevada. I have had the pleasure of being aware and involved with Nevada Health Link, also known as the Silver State Health Insurance Exchange, since actually before its inception, when it was just language and a BDR released to a bill. And actually, I had an amendment that was included in the final bill language. I have attended the pre-focus groups for the health exchange, as well as the birth of the health exchange and the very first board meetings. I've been attending board meetings off and on since its beginning, and I've really watched the ups and downs of HealthLink over the years. What I want to say, it is really, I think the phrase is cooking with gas right now. It is doing so well. You heard the numbers, you've heard who's getting insured, who's getting supplements, and it's providing what AARP and I have talked about many times, access to quality, affordable health care, and it provides that portal for people to get that otherwise would not. So that is just fabulous. I want to mention specifically funding for Decision Unit E354, which talks about navigators and in-person assisters. They are such a crucial, vital part of the system. Yes, navigators are part of the Affordable Care Act, but I'll tell you, they're really important that the funding be there to have an adequate supply of them in the community, because the broker group will always be there, because I guess the best way to put it is they make a little bit of money off of selling the insurance. The navigators and in-person assisters are all those community agencies, all those do-gooders out in the community that are really helping people to connect with insurance, and it's so important that they be there. So this money that they're able to do to help provide that one-on-one in-person assistance, which is exactly what they're called in the navigator groups, is such a crucial part of the system. So AARP strongly encourage you to support that funding on that decision unit. And the last thing I want to say is I really want to commend Heather Kerbalik, the executive director of Nevada Health Link. She has really taken it to great places and doing great things. She is so consumer focused, but understands the need to balance both the consumer focus with the industry focus, and always dealing with the federal government can be an issue, let's just say. So I think if you look up the definition of what the executive director of Nevada Health Link should be, you will see a picture of Heather. She is just fabulous. So AARP, on behalf of our 345,000 members across the state, strongly support this budget, urge you to pass it, and continue to have Nevada Health Link provide the valuable service on connecting people to quality, affordable health care. Thank you.
thank you for that comment. I'm just going to note that I did let that go on a little long, but I think that was well-deserved praise. Is there anyone else on the line?
Chair, the public comment line is open and working. However, we have no more callers at this time.
Thank you. Are there any other comments from the committee? Not seeing any. With that, I would like to close today's hearing, excuse me, and the meeting of Government Affairs Subcommittee. Thank you all so much.